CDC vital signs. Inequities in flu vaccine uptake. Flu vaccination is the best way to protect against flu, which can be serious and lead to hospitalization or death. People from some racial and ethnic minority groups are more likely to be hospitalized with flu. Rates of hospitalization for flu are nearly 80% higher for Black adults, 30% higher for American Indian and Alaska Native adults, and 20% higher for Hispanic adults than they are for white adults. Vaccination may not always keep you from getting sick with flu, but it can make symptoms less severe and keep you from being hospitalized. But flu vaccination rates have been consistently lower among Black, Hispanic, and American Indian and Alaska Native adults since 2010 compared to other racial and ethnic groups. There are many reasons for this. Some people don't have access to healthcare or insurance. Healthcare providers sometimes miss opportunities to vaccinate people. And there is a lot of misinformation about vaccination. Racism and prejudice also make inequalities worse. So what can be done about this? It's important to address the reasons why people do not get vaccinated. Community organizations and trusted messengers can help to get more people vaccinated by building trust, increasing access to vaccination, and fighting misinformation. Community organizations can hold town halls, pop-up clinics, and other outreach activities to increase trust in and access to vaccination. Culturally responsive messages can also build confidence in vaccines, raise awareness of the importance of vaccination, and help break down barriers to getting vaccinated. Healthcare providers are also integral to getting more people vaccinated. They can check to see if people have been vaccinated at all medical visits and strongly recommend flu vaccination to all patients 6 months and older in a culturally responsive way. They can give patients a referral if they don't have flu vaccine in their office or clinic. And they can educate their staff on the best way to discuss flu vaccination with patients. State and local governments can also help to ensure that everyone can get vaccinated. State and local governments can work with community organizations to make it easier for people to get vaccinated. They can work with influencers on community outreach and vaccination campaigns. They can work with media channels that reach people from racial and ethnic minority communities. They can work with faith-based and community organizations to host vaccination clinics where people work and play. And they can work with local businesses to make it easy for employees to get vaccinated. And remember, get vaccinated to protect yourself against flu and encourage others you know to get vaccinated too. To learn more, visit www.cdc.gov/vital signs/flu-inequities.